The Elder Care Medicine Network was funded by the Eugene Washington PCORI Engagement Award Program. PCORI, for those of you who do not know what it stands for, is Patient-Centered Outcomes Research Institute. And the intent of this engagement award is really to focus on creating a community of older adults, caregivers, researchers, and pharmacists to put together a research agenda created, co-designed by our community of stakeholders. And our stakeholders are not just here in the Mid-Atlantic area, but actually we're working with partners in the Midwest, as well as the Hawaii Island region. And within those regions, we have project leads and community council members of older adults, caregivers, pharmacists, and researchers to create partners from their own communities. And essentially, as we create these partnerships in these communities, we've been going out to the communities to understand what are some of their needs regarding medications and using them, as well as overseeing them as caregivers.
There is a process in this country where medications are on a routine basis being assessed for their effectiveness, how patients who are taking them feel about them, how their caregivers, which is frequently family members, feel about them. They have input on how medications are part of their lives. I was shocked to know that this age group, considered elderly, has never had a way to voice their concerns, their pleasures, their observations, their hopes, their fears about their medication. So now, on a national basis, the Elder Care Medicine Network will build a way, a process, an infrastructure for people 65 and older to be part of that conversation.
We are just one piece of a larger effort to help understand how we can help older persons and their caregivers more effectively use their medications. And there are approximately 40 of these geriatric workforce enhancement program grants currently in progress across the United States, funded by the federal government, the HRSA, Health Resources and Services Administration. Here we have one in Maryland that's also affiliated with this project. And then we have one here in Minnesota where we actually have put together a toolkit for interprofessional healthcare teams to help patients confidently manage their medications. And I do think that this is the opportunity for us to collaborate more effectively across all these efforts that are going on in the nation, to really make a concerted effort to help individuals manage their medicines in homes across America.
This issue of medication management by patients, taking their prescriptions, the complications or comorbidities that may exist with patients, this is universal across the United States. So I'm happy that we'll be able to identify the variations and the issues that occur, whether it's across the United States or within a particular state, and being able to address these and raise the flag on them, that there could be some legislators and other partners, healthcare partners, that pick up on this and want to affect change, want to improve the outcomes of care for seniors, for elders, and are most interested in that person-centered, focused care.
The value of our healthcare system is in the eye of the beholder, and we need to better understand that patient perspective and the caregiver perspective much better. And so that's what I think will be sort of the next step as we educate ourselves from the wisdom of the community network members on what we need to do to address the issues that are important to them. So really appreciate the mission of PCORI in helping us do that.